this. We're going to record this gathering so that we can share it afterwards. So welcome. I'm the executive director of our new coalition, which we're going to share the new name of very soon. It's building on 30 years of the Bay Area Open Space Council. We have 49 member organizations that are nonprofits, public agencies, indigenous tribes in the 9 counties of the Bay Area plus Santa Cruz. And during this pandemic response, we are opening up our programs to anyone who wants to participate. But I want to give a shout out to our members who really make this possible with their membership and with their participation. Today we're going to talk about public health with 2 physicians and public health leaders who also know the parks community very well, and I'll introduce them in a few seconds. I know that public health is everybody's mind, so I'm really excited to bring this conversation into, or this topic into this forum and to share it with all of you. We are going to basically have a conversation, Dr. Razani and Dr. Shannon and I, and invite you to ask questions with the chat feature. And I will moderate those questions and share them with the speakers. Let's see, in terms of housekeeping items, I do want to say that we do have some resources that we'll share via email with everybody afterwards, so that we can, again, try to move as quickly as we can to respond to what we're dealing with, and also move as inclusively as we can. There's so many different kind of organizations, and different counties are facing different challenges, problems we're facing, and also the lived experiences of the people that are on this webinar and in our community. And so we really want to be respectful of those differences while trying to move forward as a region to address the challenge. It's sometimes easy and sometimes hard to do. So with that, I'd really like to introduce 2 colleagues and friends. Many of you may know them from the formation of Healthy Parks, Healthy People. These 2 leaders really were a big part of creating the regional coalition around Healthy Parks, Healthy People. So they are parks people. They are huge advocates for nature and parks and all of the health benefits. And they also live and work in the healthcare and public health fields. So they, I think, are really excellent speakers in this moment to help us bridge what's happening in the parks world, if I can generalize it to that, and in the public health world or the healthcare world, and we'll talk a little bit about that. So first, I want to introduce Dr. Nooshin Razani. She's the director of the Center for Nature and Health at UCSF, and is also a practicing physician and adjunct professor at UCSF. And I want to introduce Dr. Curtis Chan, the Deputy Health Officer and Medical Director of Maternal, Child, and Adolescent Health at San Francisco Department of Public Health. Degrees and work in public health, and we're going to talk a little bit about the differences there and how it relates to what's going on. So hi, Dr. Razani, Dr. Chan.
Hi.
Let's start with you, Dr. Razani. Can you tell us what you do for work? Just give us a window into what your work world is like.
I am a pediatrician and I see patients 1 day a week. My current clinical practice is in juvenile hall. So I see kids who are—
Dr. Razani, can you move a little closer to your mic?
Yes.
Great, thank you.
Can you hear me now?
Yeah, if you could turn it up a little bit,
So
I think that'd be
clinician.
good.
Clinician, is that too close?
That's great.
And I currently see patients in juvenile hall once a week. I am also a researcher, and I'm working on articulating the health benefits of nature, specifically for pediatric mental health. And in that capacity, I'm working on clinical trials on nature and health. And then finally, I lead a nature program in collaboration with East Bay Regional Parks. And so for the past 6 years, once a month, I've been going out into nature with families in the East Bay.
Great. And how are you doing in this moment and with everything that's going on?
I think I'm in the mix with all of you and trying to make sense of it. I miss being outdoors, and I miss my program, and I'm excited to talk to everyone about how to make sure that we can keep enjoying the outdoors.
Great. You and me both want to be outside. Dr. Chan, can you tell us what you do for work?
Sorry about that. I'm texting urgent issues at the same time. So I'm Deputy Health Officer for San Francisco Department of Public Health, and I do a myriad of things related to children's and women's health, chronic disease prevention, health promotion. And just to give a sense of this activation, I haven't been focused on parks at all because we've all been assigned different roles, and mine was figuring out isolation and quarantine in general, helping to figure out things for the schools, childcare, senior facilities, workplaces, after-school programs, people with disabilities. So there's still a huge amount of work that we need to do, and that's just to say that there's a gap and opening for all of you in the parks community to, you wouldn't be stepping in our toes. Lots needs to be understood. So yeah, I just want to say that we don't got it. I certainly don't got it, even though I've been very involved with parks in the past. So I'm really glad to have this conversation with you all.
Great, thank you. And how are you doing, given all that you're juggling and what you've described? How would you describe how you're feeling about it?
Everybody in public health is completely exhausted because every day is like it's infinite number of things that we need to do. So we're fortunate that we have a job, and so many people are so fearful right now of completely losing their lives of loved ones as well as their jobs. So I have these mixed feelings. So thanks for asking, Annie.
Yeah, thank you. Dr. Razani, what are your peers, physicians, others in the medical community? What are people talking about? Can you give a sense of kind of what the world of doctors are thinking about, feeling?
I think it's been a bit of a time warp where a lot of things that were on a 3-year path of accomplishment have been accomplished in 3 days. Things like moving entirely to telemedicine, really creating, I think that we want to rise to the challenge, and we want to make sure that we're there for the community in a way that also keeps us as healthy as possible for as long as possible. And so we're doing things like figuring out how we can stagger our workforce so that not everyone gets sick at the same time. Of course, figuring out how to stay safe and not sick. We're also learning about this virus and how to take care of it and how to test for it and creating protocols. So I think we're spending a lot of time training ourselves and preparing, and we probably should spend more time on the emotional aspect of this. So I think we're bringing that up. And I think we want to do this right. And our role, I think Curtis and I want to bring into that discussion, not just preparing for the worst case scenarios, but how do we take care of everyone's mental health through this process. And then all of us physicians, we are also mothers and children and brothers and sisters and community members. And so we are also dealing with homeschooling our children and, making sure that our own communities are dealing with this trauma. So, we have the professional conversation and also how we're trying to be there for our families and friends.
We really are all in this together, aren't we? The personal and the professional all being smashed together in ways that we're not used to. Dr. Chen, can you tell us a little bit about the epidemiology of what's happening now? This is not a webinar about epidemiology or about the virus per se, and I recognize that there's a lot we don't know and that there are many people studying this, and that I'm not putting all the weight of the answer on your shoulders. But just briefly, could you just tell us a little bit about what's happening and what we know in the Bay Area in particular?
So I think for this parks audience, in the Bay Area, I think there's maybe 4 epidemics that are happening for park managers to think about. So the first one is the epidemic of the actual virus, of the coronavirus. The second one is this epidemic of hospital use and healthcare utilization that we're preparing for, and we're certainly seeing from New York, for example, and we've seen from Italy. The third one is this epidemic of unemployment that we're seeing the data from, and it's going to be real in the Bay Area as well too. And the fourth one is this epidemic of stress and its consequent health outcomes. So I'll just touch on the first and fourth one. So the epidemic of COVID-19, so we've known that this has been circulating for weeks. In the last 1 or 2 weeks, there's been an increase in testing. So there's epidemic of confirmed cases. So we're now sure that there's now substantial community transmission. And this is what the CDC uses as the language. So, I mean, maybe there's a few people who still say we're in moderate community transmission, but I think most people are saying we're in substantial community transmission now. So there's a lot of concerns, there's a lot of fears. And to some extent, a good amount of concerns and fears are real, particularly if they're related to aging and adult services, long-term care facilities, healthcare, because we are seeing an increase in deaths due to COVID-19. And I think just to remember that for future questions, that's a good way that some of us are starting to think about, like when we're seeing the curve in the epidemic, not just like the media has been focusing on the number of tests and the number of positive tests, but really the number of deaths. And there's a whole epidemic caused by basically our shelter-in-place orders and all these orders to really. So there's 2 things to really understand. One is the lethality of the specific infectious disease, which on the whole grand scale of all infectious diseases, that the case fatality rate is not as high as many other things like meningococcemia, Ebola, anthrax, smallpox. Those are completely in that range. We're talking about this is much more virulent than this normal coronavirus seasonal flu. Significantly more lethal than influenza for the older population. So the problem is it's taking me 45 seconds to describe this epidemiology, and we're still learning about it, but I think that's what's fueling the fear of the Bay Area community as well as park staff, because we're not able to communicate it succinctly in a clear picture. And then the fourth thing that I was going to talk about is this issue with stress and its health outcomes. We've certainly seen it in when we had the depression in 2009, and just even further studies, just the amount of child abuse and domestic violence that occurs, community violence that occurs when people are experiencing economic depression. This is even worse because not only are we having this, there's this additional layer of extreme fear and the actual virus that's actually happening. So so these are these like combination of different, this is a multi-level epidemic that's happening.
That makes a lot of sense. Personally have that really resonates with me because it is more than the virus itself. There really are all of these other impacts. And I'm curious, from your perspective, what role nature can have in slowing well, I was going to say the pandemic, but if you could address that on any of these epidemics, I think that would, the four that you mentioned, I'd love to hear that.
Yeah, so I think like it says it relates to what's happened in like California beaches in Southern California and some of the beautiful areas in Northern California. I mean, it's concerning to me, that there's community transmission. Not as concerning to me as even going to Safeway and how the shopping carts are actually wiped down, if the electronic pad is, how that's wiped down. So I think I did see some crowded beaches. I did personally, even though the beaches were crowded, I didn't see any instances where, I live along the coast, where there was substantial community transmission that it would flatten the curve. So, I mean, that it would actually exacerbate the curve. I saw, so although on some side, there was some crowding, but I didn't see actual community transmission occurring. And my wife and I, who's also a physician, we were looking out for it. So I could see if someone was taking a photo, they would say it's a crowded beach. But I was really impressed by our park staff, our community members who really seemed to take the message that to be socially distant. I didn't see a lot of groups clumping together. So I just want to appreciate the park staff that, sent out those messages. I was at both a beach in, south of Half Moon Bay, and I was also in a beach in Pacifica. I just want to say kudos to the staff. And I think people were really, I could tell the amount of relief that people had. And so I just want to really appreciate that. So that's the COVID-19 piece. The piece about the role of nature. So I think Dr. Razani and I have been, on several different like in-person conference calls and webinars with Open Space Council, and many throughout the last 8 years or so with many of you, and we've been highlighting that there's no other community resource in all of the United States like parks and open space that relieves stress that's beneficial to emotional health and mental health. So we've said that in the good times, and I think we're consistent even in the most direst times. I mean, to me, this is when our community needs it the most, and they basically voted with their feet in their cars this past weekend about how important, after being bottled up completely in their houses and listening to orders, that they decided to go all this weekend, and what we could have done in as local government and parks to figure out like how we could have spread this influx of cars and people and traffic throughout the whole week. I thought that was really unfortunate, but like people voted with their feet. They all need this. This is like a stress level that's really unprecedented in basically the world's history, that there's experiencing this level of acute stress in 1 to 2 weeks. So yeah, I think there really is, like, parks is the only answer right now. So, and we certainly heard that from all the health officer orders. All of them basically said last week the importance of parks and going outside. So it's confirmed in nature. It's confirmed in scientific reports. So. You're muted.
Speaking of confirmed reports, Dr. Razani is a leading researcher in this field. Can you tell us what we do know about the proven health benefits of nature, especially as it relates to stress? I know you've written and done a lot of studies. Could you give us an overview of what we know from the research?
Sure. I mean, I think so. Mortality is improved by just living in greener neighborhoods at every income level. So, independent of income, when they look at large census-based studies, people tend to live longer when they live around more green. And some of that is because of improvements in cardiovascular disease in particular, which is something that is strongly related with stress. And so if you live, especially for folks who live in situations of poverty, if they have access to green space, that can improve the negative impact of poverty on cardiovascular disease and even lifespan. So there are very large studies looking at census data that show outcomes like that. And then there are other experimental studies that just take people out into nature and have shown that within 15 or 20 minutes, if you take an urban person into a natural setting, you see improvements in cortisol, blood pressure, heart rate. And if you compare exercise done indoors to exercise done in a natural setting, there seems to be an added emotional and mental health benefit. And so that exercise is more fun, more enjoyable, and makes people happier when it's done. And so through both these cross-sectional and experimental studies that have been done, people have really thought about 4 pathways for why nature is good for you. And one of them is because it gives you fresh air, which actually turns out it's very important. The second is because it makes you more physically active. The third is because of stress relief. And the fourth is because of social connection. And stress and social connection or social isolation have true and real biological outcomes in humanity. As an example, when we look at childhood and adverse childhood experiences, which are really, really big and stressful things that can happen to a kid, like abuse, those bad things have a dose-dependent effect on all kinds of health outcomes in life. So the more stress, really big stress that you experience as a child, that can lead to your risk for obesity, heart disease, and even living not as long. Our work was arguing for nature as a way to relieve that stress. And so if a child can have stress relief and help them create more resilience in the way they respond to their world, that's a low-cost, community-based intervention that will have many years of benefit and lots of cost savings, which is why I feel really strongly that children should still have access to nature, especially during this time. The fourth thing on the pathway that I mentioned was that being out in nature gives you an opportunity to be social. And it turns out that being social is super important to health. There are studies looking at elderly showing that social isolation has an even bigger impact on health than even things like smoking or alcohol use. But being socially connected can keep you healthy through very, very, very bad times. And so if there's a way for us to continue having the stress relief and social support that you get through being outdoors, that is something that can help us all get through the multiple epidemics that Dr. Chan was talking about. There are lots of other downstream things that have been studied, like asthma, myopia, cognitive benefits, but I think if you really understand those 4 things, that's kind of the general pathway through which nature seems to help.
Just forget that mute button. I want to dig in on one thing that you mentioned, or that 4th pathway is around social connection. And this is one of the challenges we have in this moment. One of the many challenges we have in this moment, where the getting fresh air, being physically active, and releasing some of those stress is so important, but also we need to keep that 6 feet social or physical distancing. How how do we strike that balance, both individually but also from a public health perspective, of being outside but maintaining some of that social distance?
I mean, I can start, and hopefully the two of you can also answer, but I think that's a conversation that we all need to have together. I mean, this is a new challenge facing humanity, and I'm hoping that we can remember that we need to be socially connected, and that the outdoors do play a role in that. And so I'd love to hear from Curtis and actually the people on this listening to us to figure out their ideas on how. I don't think that 6 feet is that far, and there may be ways to maintain social connection. As an example, so I mentioned that I've been taking people out for 6 years into East Bay Regional Parks, and there are some children who every month for the last 6 years have come with us, and they've grown up with our program, and it's devastating that we didn't see each other last month. And so, yes, we are doing virtual outings, and we are going to try to keep the heart of it intact. It's not a replacement for actually being outside, but I hope that everyone that works in nature recognizes the social component of what they did and tries to keep that intact, even if it's through online connection. I'll let Dr. Chan continue.
I think that's a great question, and I agree with Dr. Razani about that. This is a good thing for UCSF Center for Nature and Health, and also UCSF. It's working in infectious disease. Dr. Razani is not only a pediatrician but also an infectious disease doctor. And before my role in maternal and child health and chronic disease, my focus was on communicable diseases as well too. So I just want to be very clear that we definitely care about flattening the curve as well too. I mean, my focus is generally reducing transmission to older adults. That being said, we need to think about some evidence-based clarity on the 6 feet issue. So the 6 feet issue is largely related to all respiratory aerosolized respiratory droplets, in which an infectious person who's coughing, a close contact is considered within 6 feet away. And I'm seeing this interpreted and and people shaming each other. So if you're passing by on a trail and the person is not infectious, it's not like there's an aura of coronavirus that's surrounding each person that's 6 feet. So the 6 feet is about like a prolonged interaction between, let's say, a caseworker at a hospital or a clerk or a registration person in the hospital being within 6 feet with somebody. That's where that epidemiology came from. And it's being utilized by, like, whether it's passing on the trail, you have to do a matrix, type move to avoid somebody, or like, but I still think there's some practical things that does make sense if, let's say, beach blankets were set off, 10 feet away. There's plenty of room that I saw in Pacifica, for example, for blanket, and they were like 12 feet away from each other, and it's still people would think that's crowded. No, that's actually okay. So that type of like translation from the actual epidemiology and science to things that are practical are things that which, institution like UCSF needs to work on with parks. I think we're seeing it in some helpful ways in which, San Francisco Rec and Park and other park districts recognize that it's actually the big transmission is, like, let's say if all the kids are like doing the same little playground and there's like 12 different kids climbing up the same metal pole, is probably where you're going to get like a lot of community transmission. So that community transmission is probably 20 times fold more than like a beach in any of our counties that I was able to observe. So I think that's what I mean by, I think, and I think, for example, so that's one concept. Another concept, and I'll pause too, is like, when this thing first came out, I thought that our health officers and the public health folks would actually go towards a cohorting of people. So this concept was really like emphasized, for example, when we were planning for the pandemic for avian flu, and which was somewhat implemented for swine flu in 2009. And it's really the concept of what 2 or 3 families really like cohorting together and being consistent. And that's like what we would be doing, for example, for schools and childcare. That has not been the official stance, just to be clear. But I just want to say the overall concepts is that um, we don't want to how do we actually do things, and those are actual strategies that were recommended by CDC, was to actually do this type of level of cohorting, because this is in response to Dr. Razani's comment about social isolation. I mean, it still probably does make sense for 2 families to go on a bicycle ride together as long as both of them are asymptomatic. Or are we going to say basically you can't see anybody else outside of your family for the next 8 weeks? So we have to think about what are actual practical things that are based upon science and risk reduction and harm reduction, in not just the infectious disease, but also in terms of stress and overall well-being for families and people.
That's really helpful. Thank you, Dr. Chan, for clarifying kind of the intention of the 6 feet and the interpretation of the 6 feet. It makes me think about also the interpretations of nature. You talked about beaches and playgrounds. And I wonder if I could turn to you, Dr. Razani, because you study nature and health. How do you define nature? And I don't mean this as an academic question. I mean it as in this moment, when it's challenging to get to nature, if we think of nature as the Mount Diablos and the Mount Tams how do we think about giving ourselves doses of nature and all the ways that we can do that? So how do you think about that?
So before 2 weeks ago, I had really complicated answers to that question based on things about biodiversity and, explaining the difference between blue space and green space and yellow space, which is sand, which is, what the literature does. But now when I'm faced with, my children maybe caring more about a device than me, I really had to kind of break it down. What do I mean by nature? And to start off with, we are nature. I am nature. My child is nature. And I'm working very hard to maintain eye contact and love and connection between us. And the literature shows that what a child needs to get through a hard time is a consistent and strong relationship with at least one adult. And so I try to tell families that you are enough, you are the whole thing, and if you cannot get outside, look into each other's eyes and be nature for each other. So that's the first level. The next level is, when you really think about nature, for me, a lot of it has to do with rhythms. And those rhythms and routines can be very soothing right now. And there's a whole there are a lot of resources out there on how to show children how to watch the moon, how to watch the sky, how to watch the sun, and how to let those things create rhythm and routine for kids. And I think that for children who do not have access to other forms of nature, what you can see from your window can still be very grounding. Growing plants and seeds can be very grounding, and I think can connect you to the rhythms and really it is rhythms and routine that you get from nature, and it's also the sense of awe and knowing that you're part of a bigger story. And so if you can grow a plant in a little pot and see the cycle of life and see that things are going to get better and understand the story of what's happening to us, then that's amazing. Short of that, if you can get outside, the studies show that nature doesn't have to be big or beautiful for children to get a lot out of it. They just need a little bit of freedom to be able to explore it. And then, yes, if you have access to the big and beautiful, then you get that feeling of awe, which is correlated with all kinds of good things. Our friend and colleague Stacy Bear, who many of you might know, is currently creating a program for how to experience awe indoors. And I think I was on the path of getting kids to have the nature feeling indoors until my great colleague Curtis Chan called me and said, yes, we should do that. And we should also push back for the right to actually be outdoors, so that we should have both. With the understanding that access to nature in the United States is a privilege. And it is well documented that access to nature parallels income and in some cases race. And so we need to fight for the right of people who don't have it right outside their doorstep to get to parks.
Dr. Razani, you talked about all the benefits to children, knowing that we're also needing these things. I assume that when you, the benefits and all that you just described also translates for us old children. Is that true?
Completely. Yeah, we need to play and we need to be, we need to play and be outside. And if we really are in a space and time in humanity when we cannot be outside, then we also need to connect to the moon and to play indoors. But I think I want to appreciate Dr. Chan's role in public health and being willing to be an ally for the outdoors, because I do think that it will take public health voices to help others feel bold enough to push back a little bit. So.
Great. Thank you. Thank you for that inspiring, those inspiring words, because it's not just about the big and the beautiful. It's we all have it somewhere nearby, or we have it within ourselves. And I think that's a really important message in this moment. And it's one that I know that the parks and the community that I'm a part of in my work world really can resonate with, and that we need to remember, because it makes it much more accessible to more people. And I know equity is really an important piece of this. So actually on that, Dr. Chan, can you talk a little bit about equity and equitable access to nature within the context of that nature is everywhere and that we are nature, but also in this moment of stress, and how it's going to affect all populations, especially those who aren't probably on this Zoom call.
Yeah, I appreciate you emphasizing that, Annie. I mean, I think the overall shelter in place orders, employment and unemployment, the major impact is going to be equity and poverty, and those, it's going to widen the gap for people. And even the ways in which people have any amount of recreation or ownership of the lands that we all live in terms of the counties and cities. So I think there's a lot of us who are profoundly concerned about the recent closures from the parks. And I think the three of us have just gotten so many emails just in the last few days. So, obviously we all know who are on this call, like, those of us who are fortunate to have, homes with good backyards or front yards, and those of us who are able to be walking distance to beautiful parks or in neighborhoods with great parks. I mean, and those are the people with more wealth, and the people who are in the working class don't have access. So if we're telling them that they need to be basically sheltering in place or sheltering homes, and is that really actually feasible in the next 8 weeks? Or it could be 4 weeks, 8 weeks, and in upcoming cycles or waves of this pandemic. So I think, yeah, I think I'm just gonna, I'd rather have just to even just listen to the community and just like look at people's chat issues, because the focus should be for all of you as park managers and park leaders is to think about that the parks are basically the only answer for people, and how do we actually have an equity lens on everything that you're doing. Those of you who, I mean, those of us who are privileged to be working in city and county government, who continue to have jobs, whether we're working in public health or healthcare or parks, what type of information do we need about this disease to empower us and support us to continue working for our community? So those are great questions, and I'd love to, we need to focus on that dialogue in the next 2 weeks.
Great. So let's, on that, I invite attendees to ask questions in the chat feature for those of you who are participating in the video portion of this. I'll moderate and tee them up to our speakers. Speaking of speakers, Dr. Chan, we have a new speaker joining us. Would you introduce our new colleague?
Yeah, this Dr. Rohan Radhakrishna, he's the deputy health officer for Contra Costa County. So we've been really focused in really the last 2 days or so, really thinking about how we can compile all the health officer orders together and really work with Open Space Council to think about what are some of the practical things and feasible things that parks can be doing. So Rohan, thanks so much for joining.
Happy to be joining this community. We've been working here in the East Bay along with Dr. Razani with park prescriptions, focusing on low-income and communities of color to get them out to the parks on the weekend. I've had the privilege to participate with my family, as well as many patients in the clinics that I serve in the west part of Contra Costa County in Richmond. A lot has been said, and I just want to add that Dr. Chan and I are really united to try and elevate that careful middle path of public health, where we're looking out for the community and also the individual and family. As a family doctor, I try and think about the impact on every member of the family and community. So we know that being at home in long-term quarantine can increase domestic violence. It can increase child abuse. It can increase screen time and habits around sedentariness and obesity. And so there are numerous ways that being outdoors and inspired by nature can benefit all the organ systems for the short and long term, can lengthen our chromosomes and stop the shortening of our telomeres. So genetically, we live longer with quantity of life, but also quality of life in the short term. So here in the East Bay, we're united with our other health officers are doing our best to keep parks open and healthy and support the staff as well as the visitors.
Great, thank you. And thank you for your work. I'm really glad that you could join and talk about, from a public health perspective in the county where changes were just announced yesterday afternoon, in limiting some access to East Bay Regional Park District, but not a blanket closure. It sounds like, I'm guessing that was part of this attempt to walk that line of providing access, but also keeping people safe. And I'm curious, from your perspective, how we can, I guess let's talk about that public health, public lands connection, and how can we come together in this moment? There's a foundation of healthy parks, healthy people. There's a foundation, a lot of our park agencies are part of counties, and so therefore are part of county health department or connected to county health departments. But how can we as kind of two different communities, different professional trainings, different conferences we probably attend, probably different skills and newsletters we're subscribed to, how do we come together right now to both keep our parks healthy and open and safe, keep our natural resources safe and healthy, as well as keep our people safe and healthy? And Rohan, let's start with you, and then I'd like to hear from Dr. Razani, Dr. Chan too.
Yeah, thank you for that question. I think at the heart of it is this phrase, we're all in this together. And what that means during a prolonged event that's a marathon and not a sprint is that we need to cross-train and get a little comfortable going outside of our lane. So county employees are technically disaster service workers and can be reassigned for essential functions for the public good. And if the health officer is determined in their order that parks are an essential public good and service for the health of the community, then we may need to shift who's supporting to keep the parks open and healthy and safe and well educated and informed for staff and the public. I think just as health practitioners and public health leaders getting into the lane of open space and nature, similarly, those from the park system, we're really looking to you as our health allies to be messengers of what is and isn't safe, to communicate public education around basic things like the 6 feet and respiratory droplets and hand hygiene and sanitation. And so we'll count on you to be extenders and messengers of key public health information, and we will be your contact experts to support in that. So we've been working with a variety of stakeholders to kind of train the trainers to get out the key messages so we can live through this marathon of an event and extend those public health messages while staying outdoors and safe as much as possible.
Sorry, Dr. Razani, you want to go next?
Sure. I mean, one thing that I think I could add is just from a clinician perspective, we are going through a lot to get prepared. And I'm anticipating that park staff, if they are going to be out and interfacing with the general public, would feel more secure if they had that type of training and preparation. And so it would be great to have partnerships where they learn everything about about COVID and have all questions about transmission answered, and then even, I don't know, could have access to personal protective equipment, or we could learn more about what concerns park staff have and park administrators have, and could work with public health to prepare them for those concerns.
Dr. Chan?
Yeah, I echo both the sentiments, and I think there's 4 things. One is, are parks truly an essential service? I think I've seen a lot of stuff from the National Rec and Park Association highlighting that parks is an essential service, and certainly parks is just an essential business, more of an just like grocery markets are right now. Auto body repair stores are, um, the people who are taking out the garbage and trash from our neighborhoods and our homes, to also at Costco and Safeway. Those are all essential businesses and essential workers right now. So I mean, it's just a question, like I've always been emphasizing to whatever bond measures or propositions are, to just really say parks are an essential service, right? Like, and people are going to be expecting this, like looking back from now, how many parks are going to be open, how many parks close for us. And, you know, we want to say, like, I would think like that parks were open and they were like they were the big beacon of hope and joy that our families have. Or are they going to be saying, well, parks were really open just for those who just live closest to those parks? I mean, I think that's a decision that parks need to be making. So if you're part of the essential service, how to be part of then the emergency response, and think about like what type of like federal funding or local philanthropic funding you could be utilized to be part of that emergency response. And then when that's happening, the third aspect is, how do you actually mobilize right now, connect with your other colleagues, 100 people who are on this call to support your staff and your volunteers to just say, like, you can be safe to be actually staffing the parks. And then reach out to, the last thing is just to reach out and collaborate with the Bay Area Open Space Council, UCSF, and your health departments. We would love to support your work. So yeah, those are the kind of 4 things we can do to work together as a region.
That's great. So let's, I'm seeing some great questions in the Q&A, and my apologies for confusing chat with Q&A. They seem like the same thing to me, but they're different in Zoom land. So I'm seeing some great questions, and we'll get to some of them in the remaining time we have. One question was, where were parks listed as an essential good, which really builds on what you just said. And people in the parks world, and I use that as a very large umbrella, including lots of different agencies and organizations, have always thought of ourselves as essential, but a lowercase e essential, meaning that we weren't, in this moment we have this, there's essential services, capital E, which are being built into public health orders and, being qualifying for certain kinds of services or funding, or, and I wonder if any of the panelists know where, in what counties have parks been deemed an essential service, and how does that work in terms of making that happen? Is that something that we can work on together as a region?
This is Rohan. I can briefly address that. So the Bay Area health officers tried to create a united message on the shelter in place, and the county councils are still hashing out some of the details of what is and isn't considered essential. So within your county, you can look to the specific order and the language. I know in Contra Costa, under section 10 of the order, that's 7 pages, we distinctly define what is essential travel, activity, infrastructure, and government functions. And we do name parks as something that is essential to continue to stay open. Now, day by day, week by week, as this gets potentially lengthened and in some areas tightened, in some areas loosened, there will be further clarification of what those definitions mean. But you can look to the specific order for your county, to the line item that talks about parks or space, and we were united on creating that. Now, parks independently will hopefully work together with their health officers to provide more nuance around what that means for density and parking and hygiene and sanitation. But it would be posted on the board. And I do want to just make one correlation. Yesterday was International Tuberculosis Day. And that was something that was discovered in the 1800s when we didn't have a cure or treatment for it till decades later. And the initial treatment for tuberculosis was not being around other people, but still sometimes being in a healthy open space, the sanatorium. And so I think we've learned historically the importance of fresh air and outdoor park spaces. I came across and hiking in Tilden, an old tuberculosis sanatorium, that there's still the old building structure there. So I think nature will present us with novel threats like this one. We've been through this before, we'll get through this one and face new ones in the future. And I think we lean on science, but also on nature to help us heal through these times.
Sorry, one of the questions that's coming up related to that, and I want to be mindful of time that we need to wrap up in a few minutes, is, well, 2 questions. One is, how does being declared an essential service support the employees of the park agencies? And that particularly it's and bringing up equity again, is that it's the employees that are on the front lines picking up trash, opening and closing gates and that kind of thing that would be most exposed to public health issues. And so how can how can we set it up so that the essential services declaration, or whatever the right word is, can support and make sure that the frontline staff are safe?
Yeah, I could take that. So I think if you know, people who know me probably more for advocating for low wage workers and employment policies than actually for park policies. So that's a great question, Grant. And you know, I think that's the part of the communications that need to be done. That taking out the trash, we're actually not in harm's way, right? This is something that's respiratory droplets that you could have the standard precautions. So that's where the equity issues need to come in play. And you know, I think there's one is communicating what they are. We need to provide. I think Dr. Razani mentioned, you know, personal protective equipment and gloves. Even though if it's may or may not be warranted to some level, we still need to provide. Parks need to provide those resources to the emergency and ask for those gloves if, and even face masks if they feel comfortable with that. So you know, and I think we're certainly seeing this, right? Like I'm saying, like the trash from Safeway is still needs to be taken out, right? So, and um, and that's the as park managers, like our park managers working with public health and working with their consultants and to actually look at what the data is and how do we actually communicate that to staff so staff don't actually so that not only are they protected from the virus, but they're also protected from the anxiety and stress, thinking that they might be exposed. Um, you know, and I think, you know, it's not just the lowest paid public employees. It's also all the physician, nurses, social workers, long-term care facilities, people delivering meals. There's a lot of us that are actually coming directly, not just from people who are in parks who by and large are not coughing. We're in harm's way. Myself and my wife were both physicians. We're in harm's way taking care of patients. And not only is this us, it's also social, it's also you know, people in the front desk and clerks who are actually in harm's way. But we do need to clarify that more, and we would love to work with the parks community to provide those types of safety reassurances.
This is Dr. Razani. I also think that some of the issues with not having those infrastructures like bathrooms and trash cans in place in the parks may also lead to inequity because only the people that physically live right next to that park or parking lots will still be using the parks. It's just going to exclude people that might need to travel a little bit farther or spend a little bit more time there or come with little children or elderly who need the bathrooms. And so it may actually, and I'm clearly not an expert in this, but I'm concerned that not having parking lots and bathrooms and trash cans would actually lead to a bigger hazard than if that infrastructure was in place.
All right, we're over time. Clearly, this is a topic that we all have a lot of thoughts, questions, and perhaps more importantly, feelings about. And I see a lot of questions in the Q&A, which are really good questions. Some of them we've touched on, others we could use another hour probably to really dig into. What I'd like to propose is that we wrap up for now, that I extend an invitation to our 3 speakers to join us at another time, because probably by next week things will change again and it might be a different conversation. But there's clearly a lot of interest and a lot of work that we can do together. So I'd like to propose that as a next step. We will also send out a recording of this webinar to everybody who's registered. And we'll also send out a link to a Google Doc where you can sign up to get more information. One of the questions I see in the Q&A in particular is, who should we voice this idea that parks are an essential service, and capital E, capital S, I think, essential service. And what can we do? What can we do as individuals as well as agencies and organizations to make this case and to really form this partnership between public health and public lands? And I know that there's a lot of work going on to facilitate that. So what I'd like to do is send out a Google Doc where you can sign up to be a part of that conversation, so that we can take the conversation offline, and we can also direct it to the people who are making those decisions and are in those conversations. I'm sorry to cut this off because I feel like we're just getting started. But I want to thank our three speakers for joining us today. I know you're so busy. I know there's probably 75 text messages you've gotten in the past hour that are all urgent. This is, this is a moment that you three have trained for and are uniquely positioned for. And we're really grateful that you spent this time with us and shared your expertise, shared your ideas, and perhaps most of all, shared your willingness to work together and see the importance of parks for public health. So thank you very much for your time. I would ask for applause, and maybe I will. It just won't be able to hear it. So everyone on the line, join me in applauding our speakers and thanking them. We will send out information. I also just really quickly want to say that we are convening other groups of people who are interested around nonprofit decision-making and fundraising, also about habitat restoration projects and how do we take care of the land and restore and work on restoration and stewardship projects during this time. And more information about that is in emails, also on our website. So with that, I thank you all. Take good care, and please go outside today. Or I should say, please find nature wherever you can find it, whether that's with your family or the sun or the moon. Take good care, and we will convene again next week. Thank you.
Bye-bye. Thanks.